Good morning, everyone. Sorry I'm running a bit late, but here we go. Canada has embraced medical authoritarianism, reports the Western Standard. Here we go. As Canada faces winter 2020 and the citizens of this country are threatened by politicians with a new wave of lockdowns, it is time to take stock and consider. There has never been a similar 6-month period in the history of Canada like the period from April to September 2020. The massive collateral damage from the lockdown is akin to national self-amputation of a limb. The self-inflicted damage has been followed by an infuriating political nonchalance at all the blood. With each passing day, it feels more and more like a stern reminder is needed for the ruling elite that this figurative blood flows from real people, and it is still flowing. Over 1 million jobs have been destroyed, and with them the independence and hopes and plans of millions. The despair of families thus affected is stark and palpable. I've met with scores of them recently, and they stare bleakly at the prospects for the future. The response from the political elite: more pontification about the benefits of the lockdowns, while Doug Ford bloviates, I think that's how you say that, and threatens, and Justin Trudeau administers the next dose of the globalist agenda. Ratings agencies like Fitch and Moody's quietly consider the ominous implications of Canada's ongoing Harry Carey. Against this grim backdrop, stands another ugly truth. Without a shot being fired, Canada, once renowned for its liberty and constitutionalism, has submitted to medical authoritarianism. In Canada, the Constitution Act 1867 apportions lawmaking powers to either Parliament or the provincial legislatures. The Constitution requires that people have representatives who consider, debate, and make laws on their behalf. There is nothing democratic about the oppressive rule of public health officials. The doctors have been in charge for over 6 months. In that time, it has become obvious they are unfit to make decisions on civil governance. They know nothing about tourism. They know nothing about commerce. They know nothing about transportation or agriculture or industry. They know nothing about the Constitution or its importance to Canada's liberal democracy. They appear to also know nothing, or at least be willfully ignorant, of the social consequences of their policy decisions, like domestic violence, suicide, and failing economy and growing civil unrest. It turns out that public health officials do know something about authoritarianism, however. Public health officials made the orders that forbade walking or exercising alone in the park or sitting alone on park benches. A public health order prohibited the gathering of citizens in Alberta to protest the economy-destroying lockdowns, where peaceful protesters were arrested and issued $1,200 tickets. It was a public health order that authorized the $900 ticket to a lone teenager in Ottawa with ADHD playing basketball by himself. I scroll down. On masks, we've heard it all. You don't have to wear them. They don't do any good. No, they're like a superpower. You are safe if you wear them. You must wear them if you can't socially distance. No, you have to wear them and socially distance. You have to wear them in church, but not in restaurants. You can go to the gym and not wear them. You must wear them during sex. The inanity of it requires that doctors be deposed and the legislature resume governance. A frightening progression in this medical authoritarianism was seen 2 weeks ago when Dr. Jacques Girard, leader of the Quebec City Public Health Authority, held a press conference to brag that he had ordered the arrest of 2 citizens and had them incarcerated at a secret location. Dr. Girard announced that the police participation was exceptional. Citizens ought to take note of the total lack of due process in Dr. Girard's actions. No lawyer made submissions on behalf of the accused persons. No impartial judge considered the constitutional issues. There was no bail hearing. The Crown was not required to show cause as to why the liberty interests of 2 Canadians should be overridden. The liberty interests of 2 Canadians should be overridden. Dr. Girard alone decided 2 people were guilty, and he decided what their sentence would be. How long can people be confined in these new secret isolation centers? No one but the health officials know. That's scary. It ought to be much scarier than COVID-19, which from recent statistics from the Canadian government has a death rate thus far of 0.009% of Canadians below the age of 60. And I'll show you some statistics. I did find a chart that's still live. Here's an interesting one. Dr. Yaf, and Dr. Yaf, you may remember her from such clips as the PCR test offers 50% false positives in populations that have low COVID, and everyone should get a flu shot. What's vaccine interference? Anyway, she says COVID-19 vaccine needed to inject normal back into our daily lives, Dr. Yap. So this is all pro flu shot. She's saying that you should get a flu shot. And yesterday I did a show talking about how the flu shot actually impedes your body's, or according to one study, I don't know if it's true or not, because who knows what's really true these days, right? But according to this study, soldiers who got the flu shot were 36% more likely to get a respiratory virus because they got the flu shot, because they didn't get the natural immunity that your body gets if you get the flu. Okay, so that's and if you get the flu and fight it off with no symptoms, even better. You still get the immunity, right? So getting the flu shot could potentially compromise that immunity and give you a higher chance of getting COVID-19, which isn't great, right? But she says that she's saying that a vaccine will get life back to normal, but she says that she doesn't know when that will be. At least she admits that she can't see the future, unlike our Deputy Prime Minister. Okay, Ontario's second wave of COVID-19 forecast to peak in October. This is fear-mongering, not based in any kind of reality. And I'll show you what I mean. Here it is. Fresh projections suggest that Ontario's second wave of COVID-19 will peak in the mid to late October and will likely send enough patients to intensive care that hospitals will need to scale back non-emergency surgeries. The forecast from the COVID-19 Modeling Collaborative, a joint effort of scientists and physicians from the University of Toronto, University Health Network, and Sunnybrook Hospital. Okay, so here is a response to this. T. Lee Humphreys says, these experts are predicting 70 Canadian deaths per day beginning tomorrow until the 31st of December. Seriously, where do they find these people? Well, at Sunnybrook Hospital and Toronto University. Here is, and the other day I was lamenting and asking for help, and I actually have received a couple of people who have reached out to help me, so thank you very much to the people who've reached out. I'm hopeful that we will get a chart up similar to this and a chart that live updates, so fingers crossed. It's looking good though. But for right now, Ontario is still giving this data. Link is in the description. You can see the deaths in Ontario by day. And this only goes up to September 23rd. And the Toronto chart actually went up to the same date. So it's the 28th today. So now here, the days where there's 0 deaths just are blank on the chart. So I don't know if this just means there's been 0 deaths since the 25th. Did you see? Okay, 23rd. I didn't see any 25th on there. 23rd I saw. So maybe there's just been 0 deaths since the 23rd. No new numbers means no new mark on the graph, right? So maybe that's the case. But there's a August 27th, and there's a long break, and then August 31st, and then a long break, and then September 1st, and then a long break, and then September 5th. So maybe they're adding space per day, but the graph hasn't been updated from what I can tell since the 23rd. So that's really not much better than the Toronto graph, but at least you can see the deaths by day. Now, at the beginning of this, at the peak, we had 83 deaths per day. Does it look like we're going to hit 70 deaths per day between now and December 31st? I don't think so. I don't think so, right? If it says Canada's death toll could hit 16,000 by the end of 2020, 70 deaths per day. Based on this, it's not likely. It's not likely. Fake news, CTV, right? I wonder where the experts are predicting that, right? So I wanted to compare flu deaths. This is 2018-19, and it says a total of, and this is the Canada.ca. Link is in the description if you want to check it out. But it's got the age groups. This is hospitalizations, and so the age group 0 to 4, right, 51, 46. These are hospitalizations, not deaths. And then here it's got a total of 613 ICU admissions and 224 deaths were reported this flu season. Okay, and it talks about which influenza deaths, etc., like influenza A or B or the avian flu or whatever. But here's an article from 2012. And it says, do thousands of Canadians really die every year from the flu? The flu folks keep saying so. I've already heard it repeated several times this year, and flu season has just started. This is what the Public Health Agency said in a recent press release. Every year, between 2,000 and 8,000 Canadians die of the flu and its complications. In a CBC interview a few weeks ago, an editor of the Canadian Medical Association Journal said 4,000 to 8,000 people die every year of influenza. It comes directly from the desk of Canada's Chief Public Health Officer. The flu is serious, he tells us from his website. Every year, between 2,000 and 8,000 Canadians die of the flu and its complications. Did you ever wonder how they knew that? The fact is they don't know that. This is scientific guess. That's not the truth. Dr. Michael Gardam, director of the Infection Prevention and Control Unit at the University Health Network in Toronto and a longtime flu watcher, told me. The fact is no one knows how many people die after being infected with the flu virus. The death estimates are not based on any body counts, lab tests, or autopsies. I think people may have the misconception that every person who dies from the flu is somehow counted somewhere, and they're not. Gardam said. The 2,000 to 8,000 number are based on computer models, a statistical guess that comes out of the end of the mathematical formula that makes a range of assumptions about death and the flu. And says they're tossing it into a big computer and they're churning out estimates, Gardner said as he scribbled numbers on a whiteboard to show me how the models work. As an upper limit, they're looking at everybody who died of a heart and lung problem, Gardner said, so you could imagine this could include people who died of a heart attack that had nothing to do with flu, but the feeling is that anybody who died of flu should be captured in there, plus a lot of other people. At the lower end of that model, they count the number of deaths officially listed as influenza on death certificates, plus all deaths from pneumonia, even though not all pneumonia is caused by flu. Another model assumes that every extra death that happens in winter is a flu death. At the risk of oversimplifying, that is the basic formula of the model. Winter deaths minus summer deaths equals death by flu virus. How reliable are the computer model estimates? I scroll down. Quote, I don't think they're reliable at all, Dr. Tom Jefferson told me. He is a Rome-based researcher with the Cochrane collaboration, and he spends his days reviewing all the research on acute respiratory infections and vaccines. He said hard data on flu deaths are difficult to get a hold of for obvious reasons. So enter modeling, which is nothing more than guesswork, highly sensitive to the assumptions you feed into the model. Give me a model and I'll make it say whatever you want, a colleague of mine always repeats. The models are only as good as the data sets that are fed into them, and that can be complicated. If someone already extremely fragile with heart or lung disease is tipped over the edge with a flu infection, is that a flu death or a heart death or a lung death? Which database gets to claim it? Right? Good question. So in 2012, they were saying 2,000 to 8,000 Canadians die of flu. On the 2018 website for Canada, they say that 224 deaths were reported for that flu season. That seems like a really good season. I just chose this one because it was at the top of Google, and I was looking for charts that showed how many people per year and age groups were killed, but I couldn't find that chart. But hospitalizations, right? I don't know how many hospitalizations for COVID-19 for people in that age group, but very interesting, right? Very interesting. It certainly isn't thousands of people of the flu. And wouldn't that be something to celebrate, right? Like we're not dying of the flu. Yay. But to give you further context on how they classify deaths and stuff, it's not nearly as scientific as we all think it is, right? It's not nearly as scientific. You get a swab in your nose after you die and they find COVID. Well, there you go. Toronto Public Health says individuals who have died with COVID-19 but are not as a result of COVID-19 are included in the death counts for COVID-19 deaths in Toronto. Right? Great work, everyone. Right? Inflate those death numbers. Right? And we'll look at those death numbers in a minute. Here's Victoria. She says, cases, frankly, I don't care about cases. Why aren't we reporting hospitalizations and deaths too? What is a case? Toronto COVID deaths, 2 deaths in the past 47 days, 0 deaths in the past 16 days as of September 17th. As far as I can tell, up to, I think it was the 22nd or the 23rd that the Toronto death chart stopped actually counting deaths. And there were still no deaths in September in Toronto. And there were deaths in Ontario, and I'll show you, right, again. But not in Toronto. So here is an intensive care physician. In April, when we were having lots of cases and lots of people dying, we were doing a fraction of the testing per day. We're doing like between 30 and 40,000 tests per day now, and we're getting hundreds of positives. Before, we were doing thousands of tests a day and getting hundreds of positives. You see the difference? There's a factor of like multiplication here to like we're doing 4 times as many, or 8 times as many tests now, if you're 40,000, right, than we were doing then, and getting the same roughly positives. So here's an intensive care doctor who says, like, this isn't a surprise, guys. Here we go.
This intensive care physician.
We increase our engagement with one another. We put people back in schools. The cases going up is not a mystery or a surprise, and in many respects it's not even news, in my opinion. It's expected.
Dr. Robert Arnfield is the medical director of the ICU at Victoria Hospital. He says rather than just case counts, a more complete measure of the pandemic is hospitalizations and deaths.
Other countries that have seen really big second wave numbers, a lot of them in Europe, have seen a different response in terms of hospitalizations and deaths. There certainly is a magnitude and there is an importance to that, but it is not anywhere near the same level that we saw back in the early waves.
As of this day, there are fewer than 100 COVID hospitalizations in all of Ontario. In London, there have been none in the last week, according to the chair of critical care at LHSC.
So, 100 cases in the hospital, and we've got to lock it down. We've got all those cases. We got all those cases, right? Cases. cases. Cases aren't deaths. I wanted to show you hospitalizations. You can see hospitalizations in age and sex here in all of Ontario, but it's kind of useless data. It's by age, not by date. I don't know how much you can break it down. I don't know how you can play with it, and you can show the data in different ways. But people in hospital in this age category. Oh, okay, so 20. That's still a lot lower than flu, right? For that age category, 37 for 10 to 19, 150 for 20 to 29, right? So this is hospitalizations. I don't know if it's increasing. This is deaths, right? None for the 0 to 9, none for the 10 to 19, 4, 20 to 29. So this is what we're shutting the province down for. The flu is something that is with us every year. And do you not think that we could strike a balance based on these numbers? Could we not protect the vulnerable populations? Because based on these numbers, right, deaths, and if you look at the 2018 flu deaths according to Canada.ca, right, their numbers here, COVID looks a lot more deadly, right? Like 200 versus, I mean, you can get to 200 there. Right. So, I mean, there is something to say about protecting people from this, and maybe HCQ and zinc, right? Like if we're talking about reality again, but do we need to lock everything down? Right. Here's some impacts from COVID-19. I think I'm going to probably be 27 minutes today. Here's some impact from COVID-19. City News is reporting the 2 opposition leaders were absent from the Commons last week as both were in isolation after contracting COVID-19. So I wonder if this is just positive tests or if they're symptomatic, if they're asymptomatic. How do we account for the false positive tests, right? If you get a negative test 5 days later, is that a false positive? Everybody say, oh, sorry, didn't actually have it. I wonder if the news would walk it back if Erin O'Toole tested negative now after, I don't know if it's been 7 days, but and then, you know what I mean? If it was a false positive, would they walk it back or just say, he's better, yay, he's rejoining? I think O'Toole would probably announce something directly, but who knows, right? CBC News is reporting COVID-19 may delay Liberal pledge to end long-term boil water advisories on First Nations. The promises are evaporating, right? COVID-19, can't do anything about it. Freedoms are evaporating, right? Medical authoritarianism. Scarborough's school temporarily closed following COVID-19 outbreak. Toronto District School Board confirmed Sunday evening that an outbreak at Mason Road Junior Public School has resulted in its closure from September 28th to October 2nd as public health officials investigate. 3 staff members and 1 student tested positive for COVID-19. Toronto District School Board spokesperson Ryan Bird said in an interview with CP24, I don't have the exact symptoms or specific diagnosis of the people involved. All I know is that Toronto Public Health requested that we close it, and we obviously take our lead from the medical experts there. So that's why the decision has been made to close it, and we've informed our school community. Medical authoritarianism. Yay! Here's CTV news from the 27th. Police close off Wasaga Beach in Ontario to non-residents after an illegal car rally. How dare you get outside and enjoy cars by physically distancing and being 6 feet apart and or wearing masks if you can't do that? If those things work, why can't people have a car show? Provincial police stopped non-residents from entering Wasaga Beach, Ontario on Saturday night after hundreds of people gathered for a large unsanctioned car rally. Police said they set up a spot checks on roads leading into the town and turned away anyone who didn't have a local address. Inside the town, officers tried to break up large crowds. OPP Sergeant Jason Follows said officers were equipped with non-lethal weapons that shoot large plastic bullets, though he said they were not fired. These types of weapons are used for crowd control. Yeah. Like, right? Really? This is insane. You're getting the plastic bullets out for those evil car show guys. Right? I mean, sometimes there have been times that I wished I'd had plastic bullets to shoot at the car guys, but not because they're showing off their nice cars. It's crazy. This is crazy. Back to this. Prior to the rally, which had seen hundreds of vintage and modified cars descending on the town, new speed bumps were installed in municipal parking lots in hopes that drivers wouldn't risk damaging their cars. As of early Sunday morning, non-residents were once again allowed back into the town. Your tax dollars at work, Wasaga Beach. You know, how do we make sure that customers steer clear of our town? How can we tick off this group of people who would like to gather safely outside and do something that they like as a community? How dare they? How dare they? Welcome to Canada. You go back to your house and you stay in that house. Don't you know COVID-19 is going to get you? In Saskatchewan, they've already issued guidelines for trick-or-treating. I think they're just going to try and ban it here. They're going to be like, no, trick-or-treating's dangerous. See this. right? You're outside. How dare you? You might go knock on somebody's door and they might have touched it 2 hours ago. Oh my goodness me. It's ridiculous. It's crazy, right? They're saying use tongs and wear masks and all sorts of others. Well, of course wear masks. It's Halloween, right? Come on. But this is just seriously. And I've heard that I don't do Facebook. Facebook is so toxic. Facebook just makes like your face melt. Why would you go onto it? It is just off. It's like a struggle session. If you don't agree with the zeitgeist of the day, if you don't agree that drag queens are totally fine in libraries, they are not. Unless you think that strippers would be good to go read stories to children. Why would you have adult sexual entertainment come and read children's stories? Have like the garbage man or the mayor or people who are upstanding members of the community, right? Come and read stories. But the drag queen, what are you saying? The library, you idiots. But like, why would you celebrate that? I got waylaid. Regardless, anyway, the guidelines for Halloween, I think they're unnecessary. I think that they're unnecessary. If you don't feel comfortable, then you have the freedom in Canada to not go out trick-or-treating. If you do feel comfortable, then go trick-or-treating. If you don't want people trick-or-treating at your house, turn off the light. That's kind of the standard, isn't it? Turn off the light. I will have my light on and candy ready to go. And it's just sad. I guess kids aren't hiding under desks worried about nuclear explosions. So we're not there. We're not there. But this is wrong-headed. This is shutting down Wasaga Beach because, residents might enjoy their cars together. Bad, right? Like that's, I don't know. Okay. After 6 months, casinos in Ontario are set to reopen this morning at 10 o'clock. Right? Right? Because COVID-19 is really, really worrisome. We've got to shut down those schools. We've got to shut down all that other stuff. But, we've got revenue and employment people here, so we got to open the casinos. I just think it's funny. Like, if you're going to... Here, transparency is... well, this is a CTV question period, and the person in the center, and I'm not sure who she is, makes the case that the less transparent our public health officials are, the more it seems like they're just making it up, and the less people are going to actually listen to them. I'm well past that. Dr. Theresa Tam lost all credibility in my mind. Oh, hold on. Got a phone call. Theresa Tam lost all credibility in my mind a long time ago. Okay, so here's the panel talking about the response. Here we go.
No, in March they were saying, Evan, we know that testing and contact tracing is essential. This is our way out of it. It has been, where are we now, 6 months, 7 months? And this is the best they've got. And I understand when the Prime Minister or the Deputy Prime Minister might say, listen, we can't have any political interference into approving these tests. But you know what they can do? The Prime Minister gave all of his ministers and his government a mandate: be transparent. So if Health Canada wants to say, as Dr. Theresa Tam and others have said, listen, these are the reasons we're delaying, we don't have the data, be transparent. Tell Canadians what's going on. Show it. Show your work, because there is absolutely no way that any of this economic recovery is going to happen if people can't get to work and can't get tested. And if the public health system and government doesn't step it up, people stop trusting them. And once they stop trusting them, they're going to stop listening to what public health says about wearing a mask and washing your hands, and we're going to have a way bigger problem on our hands. No, in March.
Well, and I don't know that we're going to have a way bigger problem on our hands, but yeah, the inconsistency with which the always moving target COVID restrictions is problematic for a lot of people. Here's the National Post talking about it. Gyms, bars, backyards. Why don't we know more about where COVID-19 is spreading in Ontario? Ever since COVID-19 cases began creeping up again in Ontario, political leaders and public health officials have been speaking out with increased exasperation and focus about large social events that could be driving the surge. Toronto Mayor John Tory decried a Scarborough house party as incomprehensible and inconsiderate Wednesday. Ottawa Public Health released a graphic Tuesday that showed how a 40-person party was tied to an outbreak that shut down 2 daycares and spread to 7 schools. In London, it was partying students. Elsewhere, it was a cottage full of friends. But everywhere, the message was the same. If you knuckleheads don't smarten up and don't do the right things, the whole province could be shut down again soon. But despite the blanket messaging, the endless press conferences and announcements, actual specific data on how and where COVID is spreading in Ontario remains surprisingly sparse. That is the biggest issue right now. We don't know where these cases are coming from, said Ryan Imgrund, a biostatistician from South Lake Regional Health Centre in Newmarket. Local public officials in the hardest hit part of the province, Toronto, Ottawa, and Peel, all spoke out with real urgency this week. The message from from all of them was similar. Ordinary Ontarians need to do more now to slow the spread of COVID-19, but outside experts worry that many in the province still don't have enough information to know exactly what they should be doing differently. Yeah, because it's been contradictory. You're asking people to change their behavior, but we haven't been giving information about, okay, where are the high-risk environments? Dr. Ashley Tootie, an infectious disease epidemiologist at the University of Toronto. Most of the insight that we gain is basically through press conferences or press briefings where we hear off-the-cuff remarks about, right now it feels very black boxy. So they cut her off where we hear off-the-cuff remarks about ... something. Right now it feels very black boxy. That's kind of funny that they cut her off there. What do we hear off-the-cuff remarks about? Wearing masks while having sex? Glory holes? I mean, what was the tipping point for you, doctor? To totally not take them seriously at all. Okay, back to this. One worry from outside experts is that all the focus on big parties and wild events might be creating a false sense of complacency among the less party prone. Just because you aren't going to keggers, that theory goes, it doesn't mean your big family dinner is safe. It means your big family dinner is safe. Black Lives Matter can get together and nobody's dying from Black Lives. We're not seeing big mass death from Black Lives Matter rallies, right? That didn't happen. It's not happening. There are states that have opened up. Florida's opening up. We're not seeing this. So your family dinner is safe. Don't let the news scare you, okay? I'm just telling you to know what they're doing. I'm going to be more than 27 today. The bigger problem, though, is that after months of lockdown, followed by a wide summer release, many people don't really know what's safe and what isn't. The province and local messaging on things like bubbles and social circles has always been confusing. Now it's outright contradictory. The province doesn't publish aggregated specific data on the kinds of places where people are contracting COVID-19. The new rules may help, experts believe. Yeah, and I don't believe any of their experts. Hello, what's your expert opinion? Okay, see you later. Next. Yeah, right. But that doesn't change the fact that ordinary Ontarians still don't know how many cases have actually been linked to restaurants or bars. They don't know how many were required at weddings or churches or temples or mosques. There's no data on funerals. There's none on gyms, grocery stores, or garden parties. That's all information that could help people make smart decisions about their lives, says Dr. Tira Kieran, a family physician and health policy researcher at the University of Toronto. Yeah, the fact that there's no data on any of this and they keep shaming us every day in the press conferences. How dare you? How dare you? How dare you? Like, come on, really get real. Like, you can't prove it. All you're doing is wagging your finger because you think that's going to get you high marks, and it's just not. Okay, here's Evan and Candace Bergen, and she says, what specifically did the Liberals overspend on? And Bergen comes out with a laundry list of specifics. Here we go.
Money has the government spent so far in legislation since this pandemic that your party says that was a waste of money to spend? Was it the CERB? Was it the wage subsidy? What have they actually spent that your party is saying that's a waste? Because what's an example of that?
Mistargeted and money not getting to where it needs to. Very simply, I can tell you small businesses. They're trying to pay rent. They're trying to pay their costs. Small businesses where the government has not figured out how to help them. We've been giving them ideas. Small businesses have been giving them ideas. And we haven't even started talking about sectors like the energy sector, not only in Alberta, but gas and oil workers in Newfoundland, forestry workers, agriculture. There's a whole sector, many sectors in this country that are being ignored by these.
So, yeah, there's lots of sectors being ignored. Small business, too, being ignored. Also by the Conservatives who are entertaining, supporting this legislation that Jagmeet and Trudeau are bringing together. Global News is saying, this is the Deputy Prime Minister being quoted here, Chrystia Freeland. Quote, this is spending that will come to an end when the coronavirus is defeated, and I actually have a lot of confidence that is going to happen, and it is not years away. Chrystia Freeland looks into her crystal ball and takes her best mom head tilt and mom tone. She's going to underline it right now. I'm so disappointed in you. Jagmeet Singh says, 1 year ago today, Justin Trudeau promised to plant 1 billion trees. And how many trees has the government planted in a year, you ask? 0. And so, Jagmeet Singh says, I'm going to support the legislation because I got you temporary sick time. And, Justin Trudeau's not doing such a bad job, you guys, except for that, missing the billion trees thing. Whatever. Seriously. He's propping up the government. Like, he's propping up Justin Trudeau. You can't hold the guy to account and say, okay, but I'm going to vote for him too. He should plant those trees, but, let's let him continue being in charge. Kean Bex points out, this man is undoubtedly a plant to make politicians look like victims. I saw this. Somebody sent this to me. I can't remember. It doesn't really matter who. People just like @reply me and things all the time, which is good. I appreciate it. I do like to be brought to stories, and I do look. It looks staged to me. This guy's like telling Jagmeet Singh. Jagmeet Singh is like, I wouldn't want to box Jagmeet Singh. I think he would very handily take me apart in a boxing match. And he's like a trained martial artist. Like, this guy can fight, right? And this guy is talking to Jagmeet Singh like, oh, next time I see you, I mean, we're gonna mix it up, right? And he's being, I don't know if he's being racist or whatnot, but regardless of what he's saying here, you can say what you want to a politician for the most part. Don't threaten them, right? I think what this guy's saying here is terrible. But at the same time, it's a plant. It's a plan. And here's the next one. Strange that this man, highlighted in red, was running around the hill threatening to charge and arrest the prime minister. He begged me to do a story about it. The two in blue were undercover cops, sidearms on the right hip. They escorted him around. So, like, there's something going on with this guy. Like, and why is he attacking the leaders? And why do we have 2 leaders missing in the House of Commons and nobody's really questioning that? Like, during World War II, right? If the shit was hitting the fan in World War II and the leader of one of the main political parties, like the leader of the opposition, was just, he was incapable of being in the House. Like, is that acceptable? Is that okay? Like, everybody's just kind of moving on with the reduced governance, the reduced sittings, everything. Nobody's really questioning it. And then there's garbage like this happening with all sorts of weird stuff happening. And nobody's questioning it. Maybe it's just the media that's not questioning it, and they should be. So here's the last thing I'll show you today. I found this. I came across it on Twitter, and I don't know, looks kind of like a neat Facebook thing. It's like a forum that looks like Facebook. There are multiple forums. You can create private ones, but this one's called the Liberty Network. I'm not trying to endorse it. I joined it. It seems okay. I joined it this morning, so it seems okay for today. I may change my mind, but so far it looks all right. I don't know. I've seen some funny memes. It seemed like other people interested in talking about things that I was interested in, and it didn't seem too crazy so far. So that's the best endorsement I can give, because I haven't used it all that much. But check it out if you're interested. I have no affiliation with this. I didn't create this or anything like that, so I have nothing to do with this. I just found it and thought you might be interested in it. So that's the end of the show today, everyone. Thanks for watching. This COVID stuff really is very concerning and crazy because they're just not looking at all at the data. And if they are looking at the data, they immediately throw it out in favor of some flawed models. And I don't think that's right either. And who's going to hold these people to account? How can we have how can we have elected officials say, don't worry about it, we're just going to let the medical authorities be in charge for an undetermined amount of time. We're going to allow them to mandate masks without having any kind of repeal mandate or any idea what we need to achieve to repeal the mandatory masks. No, and no real science to back it up. They told us that mandatory masks stops cases. It prevents the case numbers from rising. Well, hey, look at that. Mandatory masks all through August and July. And then all these cases. I wonder why. I thought masks worked. I mean, right? Like, it's frustrating. It's frustrating because they're clearly aware of this, and they're clearly not going to do anything differently than they're doing, despite all of the examples that we have outside of Canada and outside of just Ontario, outside of everywhere, right? Like, there are places that have got back to somewhat more normal than what we've got back to, and that haven't spent nearly the amount of money that we've spent. And why is our government behaving as if they don't work for us? That's a good question. I wish more press would ask directly. Thanks for watching, everybody. Check out CanadaPoly.com, check out CanadaReport.co, and have a wonderful, wonderful